Hi everyone. In this video, we're going to cover all the most important things to know about the medicine Vraylar, also known as Cariprazine. We're going to cover side effects, who can't take the medicine, how it works, what it's used for, dosing, how long it takes to start working, what to monitor while taking it, and some special considerations I think are important to know. My name is Mattias Hartmann. I'm a physician associate, board certified in psychiatry, and I work full-time in psychiatry. I make these videos for everyday people like yourself who want to better understand depression, depression treatment, and medications. Let's start off with the common side effects of Vraylar. The most common side effect is extrapyramidal reactions at 4 to 26%, but this is quite a large, wide range of things that can happen. Dystonia, these include dystonia, Parkinsonism, and tardive dyskinesia. But going based off this resource, this is what it has there. A severe restlessness can happen at 6 to 20%, headaches at 14%, trouble sleeping at 9 to 13%, nausea, 7 to 13%. Next, let's go over some of the less common side effects, which include weight gain at 1 to 8%, constipation, 6 to 7%, dizziness at 3 to 7%, sleepiness at 5 to 8%, abdominal pain, 6%, anxiety, 5 to 6%, heartburn, 5 to 7%, high blood pressure, 2 to 5%, and blurred vision at 4%. Some of the rare but dangerous side effects of Cariprazine, and also known as Vraylar, include high blood sugar, neuroleptic malignant syndrome, which is where dopamine gets blocked too aggressively and too rapidly, which can lead to symptoms like confusion and high blood pressure and fever, seizures, increased risk of death and stroke in elderly people, so usually over 65 with dementia. And this is not just for Vraylar, but it's anyone that is taking a medicine in this class, in the dopamine blocking class. And then suicidal thoughts and behaviors. This is with any psychiatric medicine, and it's for people under 25 years old. It's a rare risk, so it's about 1%. And I have a whole video going over that in a lot more depth. So if you're interested in that, in suicidal thoughts side effect, be sure to check out that video. So who can't take Vraylar? Really only if you have an allergy to Vraylar, then you shouldn't take it. That's the only contraindication. So how does Vraylar work for depression? Well, it has a complex mechanism. It works on many receptors, 12 receptors, so too many to mention. Let's go over the most important ones. So it's a partial agonist, also known as a partial activator, at D2, which is a dopamine receptor. Rexulti and Abilify work the same way, so they're all partial agonists at this D2 receptor. It works on D3 as a partial agonist, and it's very strong at this receptor, so it has some special activating properties on D3 that other medicines don't really have. It actually binds stronger to D3 than it does to D2. It works as a 5-HT2A. 5-HT just means serotonin. 2A is a specific receptor, specific serotonin receptor. So it blocks 5-HT2A. This actually decreases the risk of tardive dyskinesia. There used to be some other dopamine blocking medicines like haloperidol, also known as Haldol in the past, and many others that were called first generation antipsychotics, and Vraylar is considered a second generation antipsychotic. So is Abilify, so is Rexulti, so is many of the other medicines in the dopamine blocking class. But that's a good mechanism to have. So block 5-HT2A, decreases the risk of tardive dyskinesia, also helps with the depression. Mirtazapine has this mechanism as well, which is an antidepressant medicine. And it's a 5-HT1A partial agonist. This helps with anxiety. Buspirone works on this, also known as Buspar, same thing, and it works as an antidepressant. Buspirone is sometimes added to augment other antidepressant medicines, like if you're taking Lexapro, you might augment with Buspar to further improve depression. Gepirone is actually a newer antidepressant, which works as a 5-HT1A agonist, and it's approved. It's FDA approved for depression. There's some other safety concerns to know about it, and I did a video on Gepirone as well on the channel, so if you're curious about that, be sure to check that out. So what is Vraylar used for? Well, let's go over the FDA approvals first. It's FDA approved for major depressive disorder, also known as depression, also known as unipolar depression, as an adjunct, meaning You need a base medicine that works for depression. Let's say it's Lexapro. And if someone receives partial response, meaning they improve partially, like 50%, 25%, then adding Vraylar might be a good idea to get 100% of the symptoms improved. It's also approved for bipolar depression, schizophrenia, as well as mania and mixed mania in bipolar disorder. And then it's used off-label, so not FDA approved, off-label, but it also works for negative symptoms in schizophrenia. So people with schizophrenia might have difficulty with not expressing emotions well, not speaking much, having low motivation, not getting pleasure from activities, or not being sociable, or having trouble focusing. So this medicine can especially help out with that, and it's thought to do so via the D3 mechanism that we talked about earlier. It's also used for PTSD and also for impulse control problems or anger. A lot of the dopamine blocking medicines are helpful with impulse control and anger. So how is Vraylar dosed for depression? Well, the starting dose is 1.5 milligrams before bed, but you can take it any time of day. It's usually just dosed before bed because it makes people a bit sleepy sometimes. The usual dose range is 1.5 to 3 milligrams daily, and the max dose is 3 milligrams daily for depression. But for mania or schizophrenia, the dosing's different. You might need to go up all the way to 6 milligrams daily. So how long does Vraylar take to start working for depression? It says 4 to 6 weeks for depression. So it actually takes a bit longer than some of the antidepressant medicines. Usually they say 2 to 4 weeks. This one you want to wait maybe a bit longer, maybe 4 to 6. But for psychosis, if we're talking about psychosis or mania, it actually works a lot quicker. We want to see improvements within about 1 week. But of course, it can take a few weeks to start working or to notice the most improvements. So what needs to be monitored when taking Vraylar? Well, a few things. You want to get a baseline body weight. You want to check this every visit for 6 months. You want to do an Ames test, which looks for any involuntary movements. We're looking specifically for tardive dyskinesia with this one. You want to get a nice baseline, and you want to redo that every 6 to 12 months, depending on the risk category that the person is in, if they have any other risk factors for tardive dyskinesia, how high is their dose, etc. And you want to ask for the clinician that you see is going to ask for any abnormal movements at every visit, such as tardive dyskinesia, Parkinsonism, dystonia, or akathisia, akathisia is not an abnormal movement. It's more of an internal restlessness state. And continuing with monitoring, there's some blood work one needs to get as well. You want to get a complete blood count. Sometimes a decrease in white blood cells can happen. So you want to get a baseline there. You want to get a complete metabolic panel. You're looking at the liver, the kidney function. You want to get a fasting blood sugar. You want to get a hemoglobin A1C level, which looks at the blood sugar over a 3-month period of time and gets the average. You want to get cholesterol and triglyceride levels. And you can also get a Cariprazine blood level once it starts working to see how much has built up in the body in case it stops working in the future, to see if anything has happened and to understand why it's not working anymore. And you want to recheck these blood sugar, lipids, and weight soon after starting, and then periodically after that. These are the guidelines by the Laboratory Medicine and Psychiatry and Behavioral Science book. Some other resources might suggest less labs, less monitoring. Some might suggest more. It all depends on where you look. Lastly, let's go over the special considerations for Vraylar. So it can cause tardive dyskinesia. This is something you have to be aware of. It's an potentially permanent abnormal movement disorder. Vraylar's in the medium risk category, so some are low risk, some are more high risk. Vraylar is right there in the middle. Overall, with all the medicines that block dopamine, there's about a 4.2% yearly risk with these second generation antipsychotics, the ones that block 5-HT2A. That's 42% risk at 10 years. Now, one of the positives is you can miss a dose of Vraylar and you'll probably feel fine. Now, you might not have any withdrawal side effects because the half-life is so long, but of course, for the medicine to work optimally and work well, you want to try to not miss any doses. But since everyone misses a dose here or there, that's a nice benefit that it has a long half-life. There's the half-life of Cariprazine, 2 to 4 days, which is pretty long. But then the metabolite, once it's broken down, lasts 1 to 3 weeks. So it lasts really, really long in the body. And another positive here is that the starting dose is already in the effective range. Some other medicines you need to start and see how someone does follow up in 2 to 4 weeks, and then increase the dose further to get into the effective range, Vraylar already starts there. So you start the dose at 1.5, that's the effective range. Just stay there for a while, see how you do, see how mood improves for depression. If you enjoyed this video, be sure to check out this video on screen next on Rexulti, also known as brexpiprazole, which is also an approved antidepressant treatment for major depressive disorder. I'll go over all the things, the most important things to know about Rexulti in that video. I'll see you over there.